button.
Good evening to everyone and welcome to today's session. आपके फरमाइश with Dr. Murli Bhardwaj for the next 3 months till January 6th, where we will be charging you fully to face the entrance exam. I invite Sai Kiran, Rohi Khubde, Mithun, Arun Kumar and many more. And Shiva Subramanyam is asking to switch down the music. We will do that. We will try to add some more music strings into the quiz. Actually, only one string was added. That is only coming repeatedly. That will be a little boring. Yeah. And I'm very happy. Already we are touching 1300 quizzes a day played by different students. I want each of you to play at least 20 to 30 different quizzes, and every day around 10,000 quizzes should be attempted. It is all free. We were free, we are free, we will be free. Now, cutaneous lupus. Let us continue our review on the dermatology, and then we will go for a very dynamically driving demeanor of a 50 question quiz. So Bhuvanesh Sharma and everybody, 159 online students, very happy to share your evening with us. Cutaneous lupus. Cutaneous lupus presents like a butterfly rash is what you need to remember. It is a photosensitive rash and it is fixed and erythematous. And favorite question of the examiner, will the lesion of systemic lupus erythematosus, the malar rash is there, no? Will that lead to scarring? Please remember, there is one entity called discoid lupus and systemic lupus. Systemic lupus rash, scarring will be absent. And SLE can lead to alopecia, and exposure to sun is a predisposing factor in case of the discoid lupus. And what percentage of SLE you will get into this scarring type of a discoid lupus? 20% of cases will be that. So this is how a scarring type of a rash is the feature of discoid, whereas the SLE's malar rash is not scarring, is what you have to basically appreciate. Then if you look at the discoid lupus, there will be a central scarring, atrophy, loss of appendages. That's the reason if the discoid rash is there, then hair will not grow in that area, is what you have to basically remember. Similarly, follicular plugging and telangiectasis. These are the two characteristic features that you find in the case of the discoid lupus erythematosus, is what you have to basically remember. So this is an example of what is meant by follicular plugging, where you can see the in the discoid lupus. So discoid lupus lesions characteristically, where do you find them? On the face, on the scalp, and on the external ears is what you have to remember. This is another example of a scarring nature of the lesion in case of the discoid lupus, is what you have to basically remember. Then in the DLE, the involvement of the follicles is very classical feature. These are the keratotic plaques that they accumulate in the dilated follicles, and soon that area become devoid of hair in case of the discoid lupus. And what is meant by carpet truck appearance in case of the discoid lupus? You should be very sure. The scaly lesions that you find, the underside of them have small excrescences, and if you look at them, they are the places where hair follicles openings are seen. That is called the carpet tack appearance, is what you need to remember. So this is how that scaly lesions, if you happen to pluck out, you can see the hair follicle beginnings, which is called carpet tack appearance, is what you need to remember. Then what is meant by lupus profundus is a very important question. Lupus profundus. Very happy to see around 189 online. Many more. Today I want you to fight the quizzes. Shortly we are introducing a feature called polls. That is the 50-60 questions that we discussed. I want to give them like a poll. As you keep polling, we can see here how many polled option A, B, C, D and all that, which will be a very interesting feature. Whether to do a Twitter poll or a Facebook poll for polling by you, I'm just thinking whichever the technology that makes it easy. So lupus profundus means in the SLE lesions, if they occur with bullae, erythema multiforme, urticaria, then that combination is called the lupus profundus. So there are the few things about the SLE and dermatology that you need to be very sure about. Now, let us quickly take up 3 to 4 bullets about swimming pool and fish tank granuloma is something that you should know about. So, these are the classical fish tank granuloma lesions. Around 1 week to 2 months after a contact with a contaminated tropical fish tank or a swimming pool, then these lesions typically develop, which are called the swimming pool granuloma or a fish tank granuloma. What is the favorite question of the examiner? What is the organism leading to the swimming pool granuloma or fish tank granuloma? Common wrong answer is Mycobacterium ulcerans. No, it is the Mycobacterium merinum is what you have to basically remember. Then this is called Burulli's ulcer. What is this? Mycobacterium ulcerans is responsible for this, and there will be an itching nodule and that breaks down with a shallow ulcer. So Burulli's ulcer is Mycobacterium ulcerans, and fish tank granuloma is Mycobacterium merinum, is what you need to clearly remember. Now comes the next condition called Erythroderma. What is the favorite NEETPG question asked repeatedly? Causes of Erythroderma. That is one point you should bookmark, remember, and be able to reproduce in the exam. Whenever the majority of the skin surface become erythematous, you call it as Erythroderma. If your skin is not there, you are losing heat. So, fever, chills, hypothermia, reactive lymphadenopathy, peripheral edema, and every time your skin is getting lost, you are losing proteins. So that lead to hypoalbuminemia. Because of that, there is a high output cardiac failure, which can be the causes of the mortality in case of the erythroderma. So what are the causes of erythroderma? Psoriasis, dermatitis, drugs, systemic disease and idiopathic are the major causes of erythroderma. Then comes the alopecia. Tomorrow as a dermatologist, what is the best way to earn money? If you are treating scabies or trichophyton infections, you don't earn. It should be something different, class apart. So all the bald-headed men are your favorite clientele. I still remember one of our dermatology, one of the classmates of us who did dermatology. She says that I don't know what women like, but I love all the ball men. One ball man is 1 lakh rupees. So she does, at least gives a very soothing promise that hair will grow if I put a fertilizer on your scalp. So doctor, alopecia is one of the high yield topic for MD entrance. At the same time, it is also the topic which is a favorite area for dermatologists. Two types of alopecia: scarring alopecia, non-scarring alopecia. 5 causes for this, 5 causes for that. You should be sure one question invariably comes on that. In scarring alopecia, there is a fibrosis, inflammation, loss of hair follicles. And in non-scarring alopecia, the hair shafts are gone, but the hair follicles are preserved. And that is the reason it is a reversible alopecia, a non-scarring alopecia. So this is how a typical non-scarring alopecia looks like. Now what are the causes for the non-scarring alopecia? Telogen effluvium, androgenic alopecia. If your testosterone is very high, you are too much a manly guy, you get a androgenic alopecia. Alopecia areata, which is an autoimmune phenomena. Tinea capitis, traumatic alopecia. They're all the non-scarring alopecia. Please don't forget, tinea capitis is infection, infection means inflammation, inflammation means scarring. Like Einstein, if you are calculating E is equal to mc square, you will be doing an absolute mistake in exam hall. So now only you should be clear. Tinea capitis is not a scarring alopecia. Most frequently wrong answer by the students is what you should be very sure about. Now, what are the different hair loss types? You have a traction alopecia. Suppose if you are tightly tying your hair lock, that leads to traction alopecia. Anagen effluvium. So, whenever you are receiving cancer chemotherapy, you lose the hair. That is anagen effluvium. Generally, what is anagen? Anagen is also called the growing phase of the hair. It is like kharif and rabi crops. So, whenever you are using a radiation therapy or a systemic chemotherapy, then this anagen phase becomes shortened. Because of that shortening of that anagen, which is the hair growing phase, the people end up in the alopecia, which is called alopecia effluvium, is what you need to remember. What is alopecia effluvium? Because of chemotherapeutic or radiotherapy leading to shortening of the anagen, which is the growing phase of the hair follicles. That's all you remember. Then you have cicatricial alopecia, where the hair follicle is also lost. So it is irreversible. Then telogen effluvium. What is meant by telogen effluvium? The thinning or shedding of the hair because of the early entry into telogen phase. So what is meant by telogen phase? It is the resting phase of the hair follicle is called telogen phase, is what need to be remembered. Anagen and telogen are very simple, doctor. You remember in the medical college, when do we read most? Only 2 times in medical college we read the most. First year anatomy, physiology, biochemistry, that time if you fail 6 months you have to sit in home. So we read a lot. We don't want to lose the beautiful girls and boys in the class. Moving forward and we remain as a referred batch. We don't want that. So that is basically what? Telogen phase. Then second is the final year MBBS exam. That is another phase where if we fail, all our classmates will go to internship and we remain. So that is telogen. What is anagen phase? After MBBS, after the first year is over, anatomy is over, that is the most spoiled phase of the medical college. At least we will fall in love couple of times, breaks, heartthrobs, dumping, We pass through all those syndromes and ultimately our telogen phase will be completed. By the time we realize that we are already in final year and we have not read at all the pathology and pharmacology, right? So, telogen, an agent, effluvium, you have to be 100% sure about. So, what is the most common cause for a diffuse hair loss is my question to all of you. So, typically it is a telogen effluvium where there is a partial temporary alopecia after a severe major illness, pregnancy or a high fever. So, they are all the important predisposing factors, and this will resolve spontaneously after a period of time after that stress phase is over, is what you have to basically remember. So, in the puerperal phase or whenever there is a lot of stress, every time the lady is combing, she is losing the hair, is an example of telogen effluvium. So, what are the causes of telogen effluvium? One of the favorite question of the examiner. Endocrine causes hypothyroidism and also hyperthyroidism. Postpartum, similarly peri or a postmenopausal state. Then biotin deficiency, essential fatty acid deficiency, iron deficiency, protein deficiency, zinc deficiency, anything can cause telogen effluvium, one of the favorite questions of the examiner. Similarly, various drugs can also cause diffuse hair loss because they can induce a telogen effluvium. But there is only one drug, instead of causing telogen effluvium, it leads to anagen effluvium, that is the daunorubicin. Otherwise, most of the drugs, cancer, chemotherapeutic drugs, etc., I mean, there are certain drugs that lead to telogen effluvium. Then what are the drugs for which alopecia is considered to be a side effect, is a favorite MCQ of examiner. Warfarin, those who take warfarin, heparin, propylthiouracil, carbimazole, lithium, beta blockers, vitamin A, colchicine, amphetamines. Those who take that, for them alopecia is considered to be a side effect. So, a non-scarring versus scarring alopecia. So, where do you see non-scarring alopecia among the systemic conditions? Secondary syphilis, systemic lupus erythematosus. They are the two things leading to non-scarring alopecia. Then what lead to scarring alopecia? Lichen planus, follicular decalvans, cutaneous discoid lupus, linear scleroderma, they are the ones which lead to the development of the scarring alopecia. And even sarcoidosis also is another important example of less common cause of scarring alopecia. So, somehow you have to bookmark and set up a reminder asking the U-Medico app to give you reminders on causes of scarring, non-scarring, and telogen effluvium and anagen effluvium. You have to be very sure. If a question comes in alopecia, mark it as my word. Commonly, it is the causes on which the questions come. Now comes the next important topic, alopecia areata, which you need to know. These are called exclamation marks. Actually, these are autoimmune phenomena, alopecia areata. So you can see like a question mark, there will be a hair follicle which is called the exclamation mark hair, is what you have to ultimately remember. Now, it is autoimmune in origin. Scalp is the usual first site. Then there is an associated feature in alopecia areata. A lot of times this was asked as an MCQ. Pitting of the nails. Psoriasis is one place where pitting keratolysis is seen. Similarly, pitting of nails is also a feature of alopecia areata. Then, don't give testosterone. Testosterone is contraindicated in the people with alopecia areata. and minoxidil is the one which is used for the treatment. Now, how is a common clinical vignette given in the exam hall by the examiner doctor on the topic of alopecia areata? Like this: a 45-year-old woman, she has lost most of her hair, including the scalp, eyebrows, eyelashes, axilla, groin. Even there also she lost the hair. Then what is she most likely suffering from? Such an extensive loss of the hair can only be possible among all these in alopecia areata is what you have to basically remember. Then few comments on pemphigoid gestationalis. 3-4 comments. So first of all, recognize in a pregnant woman how the pemphigoid gestationalis looks like. So it is also called herpes gestationalis, but why it got the name pemphigoid? There is a subepidermal blistering that can happen in the skin, just like pemphigus in case of puerperium. And any trimester it can happen, but generally in the puerperal period. And on the abdomen and on the trunk and on the extremities, you have the pemphigoid gestationalis. Though it is called herpes gestationalis, herpes has nothing to do leading to the skin lesions. That is what you should remember, one of the favorite questions of the examiner. And these are urticarial plaques and papules. That's a classical feature. And there can be even frank bullae is what you need to understand. They're very pruritic, and there will be a severe exacerbation typically between 24 to 48 hours after the delivery. So that is how they present, and they have a tendency to recur in the subsequent pregnancies. This is one very important question in obstetrics, doctor. Please don't forget. Fatty liver of pregnancy, cholestasis of the pregnancy, then papules and purpuric lesions of pregnancy, PPP, eclampsia pregnancy, and the herpes gestationalis. Among these 5 lesions, which recur, which do not recur in the subsequent pregnancies, which present in first trimester, which present in last trimester. This is something that you have to be 100% sure about. There is one video called Medical Disorders in Pregnancy in our video library on the UMedico app. So please take a quick review, and DNB question bank is also there. Where topic wise last 15 years of DNB questions have been discussed. The video lectures are there. You can review them. So that will actually help you to pick up most of the high yield areas which are the examiner's favorite choice. So someone is asking from Nepal, how can we consume the UMedico subscription? It's very simple. Just WhatsApp our helpline number 9000-868-356. So they give you some dirt cheap price for next 3 months of access until the exam. The entire unlimited usage of the video library, mock tests, notes, everything you can be able to consume. So these sessions are absolutely free, but if you want to review more amount of content of the video and all that, and even these videos are also uploaded into the UMedico and anatomytomedicine.com. But what I want to tell you is, these 5 conditions, fatty liver of pregnancy, cholestasis of pregnancy, HELLP syndrome, and the herpes gestationalis, which recurs, which do not recur, is one of the favorite questions of the examiner. Now comes Pyoderma gangrenosum. There are few comments which you have to be very sure about this lesion. How is the border? That necrotic edge is classical. There is a peripheral erythematous halo which is present, and it is typically a undermined bluish edge classically. What is meant by the phenomenon of pathergy? Pathergy. What is the meaning of that? Typically, those areas which undergo trauma, there the lesions of Pyoderma gangrenosum develop. So this is called the phenomenon of lethargy, which is classically seen in Pyoderma gangrenosum, is what you have to be 100% sure about. So typically the Pyoderma gangrenosum, if you do biopsy from the edge, you will find a neutrophilic infiltrate, and there is a peripheral erythema undermining border, tenderness is there, and very importantly at the sites of trauma there can be a appearance of the lesion which is called the phenomenon of pathergy. One of the favorite questions of the AIMS question bank, phenomenon of pathergy. Now doctor, where do you see Pyoderma gangrenosum? The underlying causes of the Pyoderma is a favorite questions of the examiner. Inflammatory bowel disease, all of you know, chronic active hepatitis, seropositive rheumatoid arthritis, polycythemia vera, myeloma, in all these you can find the Pyoderma gangrenosum. Now comes dermatomyositis. This is a topic of clinical science. There is a name for every clinical sign. Examiner favorably asks them 4 or 5 bullet points you should know about dermatomyositis. Both skin and muscle are affected. Females are commonly affected. How will be the history of dermatomyositis? I can never forget the first case of dermatomyositis which I have seen in the MD first year. Lot of times we read in Harrison's Internal Medicine and here and there. Reading is different, diagnosing when the patient is having is different, and managing about 10 cases carefully, bringing a good outcome is different. Everything is its own story, doctor. You should be fortunate to see certain cases that you read in the book. So, the patient is the sister of the district magistrate. So, he brought her. So, patient typically is saying, डॉक्टर साहब मुझे पायखाना जाके चढ़ने से बहुत मुश्किल हो रहा है डॉक्टर साहब, आई एम अनेबल टू डू, प्लीज हेल्प मी. दैट इज हर, दे हैव ए टिपिकल rural area, a Indian type of a latrine, so she has a difficulty to get up. Oh, is it only while you are using the toilet or anything else? I asked. No, हम तो whenever we go to the social functions, when I have to sit down, I am unable to get up, doctor, please help. So she was having a classical heliotrope rash. But heliotrope rash, why it is called heliotrope, you know? Because this is the kind of a rash which is the heliotrope rash, doctor. The color. These flowers are actually called heliotrope flowers. I still remember my medicine chief, luckily we passed out in the hands of one of the wonderful teacher called Professor Shantaram. Professor Shantaram is the father of the cricketer Lakshman. We were the last batch of the MD General Medicine students. Such a wonderful teacher. He holds your hand and makes you to feel the pansystolic murmur. He will make you to listen and reproduce the sound. Lab is the typical early diastolic murmur of aortic regurgitation. Such wonderful teachers, very rare to find. So he asked a question, doctor, why that rash is of that color? Why is that rash? What is that color called? So we get top seats without knowing heliotrope rash means dermatomyositis. We read a lot and get the top rank. I was not able to answer. So he asked, quickly run and check in Google what is heliotrope. So heliotrope is this flower, and the heliotrope rash has got that typical appearance. So how do you diagnose that her weakness to get up, which is the proximal muscle weakness, is plus this rash on the eye, which has the heliotrope color? You should combine the two and then strike a diagnosis of a possibility of the dermatomyositis. Then you should order for a quick CPK, the creatinine phosphokinase levels, and the creatinine phosphokinase levels are significantly elevated. That is how you make a diagnosis of dermatomyositis. One time you see a case, throughout life you are like a topmost rheumatologist coming from Europe, right? So heliotrope rash, please don't forget. Then on the knuckles you have this scaly eruption. What is this called? Gottrens papules classically are the feature. Then on the neck and the anterior chest, you have the rash in dermatomyositis. What is this called? V sign is the name given for this. And you have a rash on the back and shoulder. What is this called? Shawl sign is the classical feature of dermatomyositis. And you have a proximal muscle weakness, and sometimes dermatomyositis can be a manifestation of an internal malignancy. It can be a paraneoplastic feature. In about 10 to 20% of cases is what you need to remember. Periungual telangiectasis. Beneath the fingernails, you have telangiectasis, which is another important hallmark of dermatomyositis. So you can have hypopigmentation, hyperpigmentation, telangiectasia, Pyoderma vascular atrophicans. Any of them can happen along, but 5 important bullet points: heliotrope rash, Gottrens papules, V sign, shawl sign, and periungual telangiectasis. They are the ones which should sit in your mind when you are going for the tomorrow's exam. So that is a dermatomyositis, doctor. Now, question is, Alopecia is asking, sir, finally clinical or biochemical? What is the this thing? It is the chemistry you have with the patient is the underlying reason for bringing out the diagnosis actually. Always remember, doctor, your history is the thumb. 90% diagnosis should come when you are listening to the story of the patient. And the clinical examination is like your ring finger. And laboratory is like your little finger. That is the simple rule of the clinical medicine. And even if you are the best guy who mastered entire Harrison, the whole idea is first time somebody should help you to make out a diagnosis. Next 5-6 times you should wrongly diagnose, and by about 7th or 8th time you call yourself as an authority of clinical diagnosis. That is an inevitable transition that you need to basically pass through. Now, mycosis, let us quickly run through some of the common dermatological cells and favorite MCQ of examiner. In mycosis fungoides, what is this cell basically? It is a T lymphocyte. In lupus erythematosus, what is this cell? LE cell. Fundamentally, what is that? Which kind of cell is the LE cell? It is a neutrophil. Then you have lepra cells. They are the derivative of which kind of a cell? Is a favorite question of the examiner. Plasma cell derivative is a leper cell. Then in the Jank smear you have Jank cells, which are the multinucleated giant cells. How are they basically formed? It is the acantholytic keratinocytes fuse with each other, and they lead to the formation of a Jank cell. So Jank cell fundamentally is a modified keratinocyte, is going to be your parrot-like answer in the tomorrow's exam. Virchow cells that you see in leprosy, what are they? All those foamy macrophages infiltrate the dermis, and this large collection of the foamy macrophages infiltrating the dermis are basically called the Virchow cells. Virchow cells are fundamentally foamy macrophages. Then what is Majocchi's granuloma? The tinea, yesterday we discussed now, tinea rubrum is called as Majocchi's granuloma. Then where do you see palisading granuloma? The granuloma annulate, where there is a central collagen which has undergone degeneration, and that forms a palisading granuloma. Then what is granuloma inguinale? It is the Calymatobacteria granulomatosis leading to the ulcerative lesion on the genitals is basically called the granuloma inguinale. Now there are certain associations in dermatology, spotters, which you should be ready. Tomorrow's examiner is going to give you image based questions in the exam. right? So Pseudomonas, what leads to hot tub folliculitis? Favorite question of the examiner, Pseudomonas. Erythema gangrenosum, the other day we have seen a Pseudomonas septicemia with a widespread ecthyma gangrenosum lesions on the day 1 when we were discussing last Monday, right? Then HSV, whenever people are wrestlers, Dangal movie, right? So herpes gladiatorum is the one which is caused by herpes simplex. Then on the fingers you can get the lesions of HSV, which is called herpetic whitlow, once more caused by herpes simplex. Then Streptococcus pyogenes is the one responsible for those purulent lesions called impetigo contagiosa. Bullous impetigo, as what you can see here. What is the causative organism? Is a favorite question of the examiner. Staphylococcus aureus is the one which leads to bullous impetigo, is what need to be remembered. Swimmer's itch, where do you see? Typically, those who are exposed to the water infested with the cystosomes, they can develop swimmer's itch, is the name given for the cystosoma infection. Bacillary angiomatosis with all those vascular lesions, where do you find? Bartonella Hensley is the one which is implicated in bacillary angiomatosis. These spotters in dermatology, you have to be 100% sure. Then Verruca peruana, it is also caused by Bartonella. Bacilliformis is the one which is responsible. Then Verruca vulgaris, these are the lesions. Human papilloma virus is the one which is implicated. A very important spotter, which is a strong image based question. See doctor, there are about 1400 image based questions made available in the UMedico app. When you go to UMedico app, you go to quizzes. Once you click on the home button, in the quizzes, you have image based questions available. You click on the image based questions and start playing the quizzes. 10 MCQ quizzes. Whenever you are bored while studying, you play the quizzes. So in the image based questions, if you are getting 8 out of 10, 7 out of 10, once more go and check what are those 3 questions, why you are wrong. So that is how you will get the acumen if you can solve all that 1400 to 1500 questions image based. There's more than a practice required for facing the image based questions in the real exam. Okay, doc. Then condyloma acuminata. So typically the human papilloma virus can lead to anogenital condyloma acuminata is what you need to remember. Mycobacterium leprae can sometimes lead to cutaneous ulcerations, especially the people who are having lepromatous leprosy patients. This is called Lucios phenomena. So many times asked in the All India entrance exam. Lucios phenomena, you have to be very sure about. Then this kind of erythematous lesions are called erysipelas. Erysipelas are Streptococcus pyogenes. Exam hall mein agar is this Streptococcus pyogenes, is it Staphylococcus? If you are thinking now, you are very slow, right? I want you to attack the examiner's question paper. 300, you should finish in 200 minutes and walk out of the exam hall. That is what I am waiting. You should be in the top 100 ranks. There is no other way. Then necrotizing fasciitis is because of what? Once more, group A, Streptococcus is common responsible. Cellulitis also, both Staph aureus and Streptococcus pyogenes are responsible, is what you have to remember. So how the examiner will ask a clinical vignette on erysipelas? Infant, superficial cellulitis, marked lymphatic involvement, and beta hemolytic group A streptococci, it has caused it. When so many clues are being given to you, it's a complete striptease. You should be ready to answer it as erysipelas is what I want to underscore to all of you. So that is the dermatology for today, a little short session. I need one more day. By tomorrow, I'll complete the entire dermatology funda for you. in the next 1 more hour of your time is all that is required. So the time, unfreeze your fingers, get ready for the quiz, give a call to your friends, quiz time started, and then join the quiz, punch the answers, and let us look who is good, who is strong, who is going to make it. Yes, doctor. Please call your friends to join. We are trying to create one instant polls. If that application works, then we can also start seeing how you are polling the answers instantly. Yeah, very good, very good, very good, very good. I'm finding a rocking answers. Inflammation will not be there in hepatosis. I know, I know. Only Sudhir Kumar is a sheep which is out of the herd. Dr. Sudhir thinks cell shrinkage now, inflammation. Which is an anti-hepatotic gene? Shoot your answer, doctor. Please mention the question number. Question number. Anti-hepatotic gene, which is the one which is called as anti-hepatotic gene. Yes. Let me check how good you are. I am seeing BCL2. Some of you are saying backs. Oh, some of you are thinking back. Most of you are differing between ABC, but all those who said BCL2, Jindabad. So, doctor, backs, back, bad, bid, big, HRK. They are all pro-hepatotic. BCL2, BCLX, BCLW, then BRAC1, MCL1, A1, BFLM, they are all anti-hepatotic. Since you have done this question wrong, you have to once more mark it. Tell the UMedico app, hey, give me the reminders. Just give me 1 more week of time. We are going to set up the entire notes with reminder notifications feature, and you can also voice record a particular point and can be able to listen those points which you want to revise from your own voice. So all those additional features we are adding. 324, what is your answer, doctor? Excellent. Come on, Akash Rai, you are in a very, very primordial stage of preparation. Yes, those who answered D, excellent. This is the easiest question. Agar ye bhi answer wrong kare to we are in a amoebic phase of the preparation, honestly, right? So you should improve, doctor. This is one area. Interleukin 1 is for fever. Interleukin 3 stimulates bone marrow. Interleukin 5, IgA production. Interleukin 8, neutrophil recruiter. IL-2 stimulates T cells. IL-4 stimulates IgE. IL-6 stimulates acute phase protein production is what you have to basically remember. Very happy to see 307 watching. Yes. Please don't forget WhatsApp 9000868 our helpline. They will give you a dirt cheap option, easily affordable pay for next 3 months of access to the entire video library, mock tests, everything, including this bulleted discussion video library for you. So please feel free to WhatsApp, and they will give you one Paytm number. You can be able to pay through the Paytm, and they will give you a instant access and to the mock test, video library, everything for the next 3 months. Sibtuin is associated with, I'm seeing between Seema Vishwakarma proposing increased longevity, and Canopy is proposing option A. Very good, increased longevity. One comment on telomerase you should know, doctor. What is telomerase? It is an RNA protein complex. It uses its own RNA as a template for adding the nucleotides to the end of the chromosome. Where is telomerase activity high? Where is the telomerase activity low? Telomerase activity is very high in the germ cells. So that brings a ability for replicate. And it is in low levels but still there in stem cells. And absent in somatic tissues. That's the reason somatic tissues cannot be able to regenerate. And whenever the cells are aging, then the telomeres become shorter and they exit the cell cycle. And how the cells become immortal, doctor? The telomeres are basically, telomerase is reactivated and telomeres are no more shortened. What is paradoxical about telomerase? Ase means it will cut, we think, but telomerase doesn't cut and make the telomere shorter. Telomerase enables telomere to remain longer and increases the longevity is what you have to basically remember. Very important question, frequently asked. Now give me a strong answer for this question, doctor. Yes. A strong answer for this question. Yes. I'm saying beta 2 microglobulin. Ravi is proposing amyloid A protein, and Shivam is proposing alpha 1 acid glycoprotein, and Aparna is strong about fibrinogen. Beta 2 microglobulin is not an acute phase reactant. So what are called the acute phase reactants, doctor? C-reactive protein, serum amyloid A protein, and fibrinogen, alpha 1 acid glycoprotein, alpha microglobulin, and macroglobulin, ceruloplasmin, haptoglobin, hemopexin, murinoglobin, thiostatin. These are all called acute phase reactants. So beta 2 microglobulin is not called acute phase reactant. You have to be 100% sure. Sometimes questions are easy, but answers can make you thadap ke. You will be regretting after coming out of the exam hall. That is all the entrance. For everybody it is the same. Now doctor, hyperacute type of kidney rejection is associated with which HLA class? Dipesh, Shivam, Mithun. Oh, Sudhakar is triple time sure that it is type 2. Oh, very good. And Dr. SB says it is type 3. Okay. HLA type 3. Okay. Most of you are standing on type 2, but nobody said type 1. Type 1, doctor, type 1. So, donor T lymphocytes representing anti-HLA class 1, they are the ones which predict the acute vasculitic event of hyperacute rejection. Very good. Rohi Kubde said that it is type 1. Don't forget it. RH incompatibility, very easy question. Everybody is going to cram this. Answer, yes. What is your answer, doctor? RH incompatibility. What is the type of yes, I am seeing type 2. Few of you are saying type, most of you are saying type 2. Very good. Type 2. When the antigen is fixed, antibody is free floating and it goes and attacks it, it is type 2. Antigen is free, antibody is free, both of them together met each other, became a complex, and they went and deposited on the tissue. Then that is called as immune complex deposition condition, where you have typically type 3 is what need to be remembered. 329, what is your answer, doctor, with regard to the blood group antigens? Yes. Yeah, what is your answer, doctor? Very good. I am seeing Duffy, few people saying Kelly, and Charulata is saying Louis. Anjul Nigam says Louis, but little doubtfully. Devashis Priyadarshan Sahu said means we have to agree, right? What is the famous rule, doctor? Duffy dies, Kelly kills, and Louis lives. That is the important rule. The Louis antigen, mild hemolysis, but it is not fatal. Whereas Duffy and Kell antigens, they can cause significant hemolysis. Favorite question of the examiner. You should never do a mistake of this question. Yes. So, yeah. Amyloidosis leads to what type of cardiomyopathy? Very easy question. You have to crack this question invariably. Yeah. What's your strong answer, doctor? Avinash Dhaket is proposing B. Some of you are saying C. Okay. Yeah. Deepthi Uttam is also proposing restrictive. Very good. So, this is one question, doctor, once more. One of the favorite questions, restrictive. So, hypertrophic cardiomyopathy may what you find is a problem with relaxation. So, diastolic dysfunction. Dilated cardiomyopathy may heart cannot pump only. That is called systolic dysfunction. So, left ventricular hypertrophy, hypertrophic cardiomyopathy, restrictive cardiomyopathy, transient ischemia, they all lead to diastolic dysfunction. Similarly, mitral stenosis, pericardial constriction, pericardial tamponade, they also affect the filling. So, that is called diastolic dysfunction. One of the favorite questions of the examiner, which you should not do a mistake. Right? Now, the next question. T cell dependent tubercular antigens produce which of the following type of antibodies, doctor? Tubercular, you have to give, question looks easy, but answer is not that easy. Ravi Kumar, Kushbu, clean bowl. Lalit Karki, clean bowl. Even Jambuswala, very good. Shashank Lakhala, absolutely right. IgG and IgA are the ones. Typically, TB has got glycolipidic antigens, and it is the IgG and IgA which are the ones which are active against it, is what you have to basically remember. Now, doctor, I know this question all of you answered correctly. Yeah. Should be the correct answer? Yes. The next question. HIV antigen which is found earliest. Very good. P24 antigen. P24. Excellent, excellent. Most of you are correct. What is the CD marker for Epstein-Barr virus is a very important question. Yes. What is a CD marker for Epstein-Barr virus, doctor? One nagging answer. I am finding Vishal proposing it as CD19. Is it 19 or 21? Daskatis, 19 or 21? 21. See, doctor, CD markers is another disgusting topic. You have to keep notifications set for it that somebody reminds you, hey, what is the CD marker of that? Hey, what is the CD marker of this? Some reminders, if they are there, you will remember. But one question, CD ke bina question paper nahi hota. Now comes amoebic colitis. How do you want to basically diagnose? By demonstration of what do you want to diagnose? The amoebic colitis is my question to all of you. I am seeing between B and D. B and D. That's good. Trophozoites. In fact, erythrophagocytic trophozoites actually, not in all cases you find it that classically. Yeah, this is an easy question. 335. Shoot your answer, doctor. In case of Takayasu's arthritis, the pulseless disease which is called as, what is the type of histopathology do you see? Please type the question number. Very good. I am seeing all of the above. No, no, no. Why you are so tempted for all of the above? I am finding Mr. Ran proposing fibrinoid necrosis. Fibrinoid? Come on, doctor. Granulomatous aortitis is the name itself given to the Takayasu arthritis. This is large vessel vasculitis. That is what you need to basically remember. Vasculitis is one topic, doctor. In the U-Medico video library, you have to review DNB past question bank theory. There are about 50-60 points on Takaya on the various vasculitis. Inevitably, out of 300 questions, one question on vasculitis के बिना अगर नहीं आए तो मुझे पूछो. NEETPG में definitely it is asked. So, doctor, lacunar cells that you see, where do you see the lacunar cells is a very important question. In which variety of Hodgkin's lymphoma? Very easy question. Yes. Yes. Nodular sclerosis. Excellent. So, once more, doctor, let me tell you. Hodgkin's lymphoma, non-Hodgkin's lymphoma. And one of the 4 types of leukemias. ALL, AML, CLL, CML. इसके बिना क्वेश्चन पेपर होता ही नहीं. अगर इसमें रॉन्ग किए तो you have to first revise those topics and then go for dinner. So that is going to be the plan. It is a nodular sclerosis. Absolutely right. Most of you correctly answered. Good. So these are the classical example of the lacunar cells is what you need to remember. Now, doctor, which kind of asbestos has the maximum risk of leading to the mesothelioma is my question to all of you. Give a strong answer. The name itself is suggestive. Yes. Which type of mesothelioma? You mean anthophyllite? Danish chrysolite? Lalit is also saying chrysolite. Why are you all fascinated by that? Dr. Nimisha Srivastav, Jindavad, that is crocodilite. Crocodile is very dangerous, no? It will eat you. So, crocodilite, try to remember. Now, if somebody answers this question, doctor, I will call you are the NEETPG Mahir. Let me check who will give me the correct answer for this question. Basophilic staining of the vascular walls, where do you see? Medquest is saying, I am 100% sure, sir, answer is C. Okay. And Shabanu is thinking it is adenocarcinoma. Okay. But very good. A very good number of you are answering it as small cell lung cancer. I am very happy, doctor. Small cell lung cancer. What is that called? Ezopardy effect. What is Ezopardy? Somebody was typing Ezopardy effect. I am very happy. Bala Murugan is the one ready for Tamil Nadu topper. Small cell carcinoma, they are highly malignant. Chota बहुत जल्दी भाग सकता है. So a small guy can run fast. So small cell carcinoma, metastases are very wide and there is no surgical management for the small cell carcinoma. One of the favorite question. Which type of carcinoma where surgery has no role? Small cell carcinoma, by the time you detect only, metastases are found everywhere. So the necrotic cells, they release the nuclear DNA. And that dark blue nuclear DNA material, it will be lacing the small vessels like venules and capillaries, which is called the Ezopardy effect, where there is a basophilic staining of the vascular walls. And this is the typical Ezopardy effect. When you are using a fulgent stain, you can be able to detect this, what you have to basically remember. Now, doctor, in alcoholic hepatitis, what is your answer? The hyaline inclusions, what are they made up of? This is a very fundamental question. Yes. Koshmita Karki is presenting bimentin. Oh, some of you are thinking cytokeratin. Very good. Lalit Karki proposes intermediate filament. So also Arshad Musa. Very good. I'm very happy. Kush Hua Mogambo. This is definitely a very interesting question. All these filaments, where are they found? These are the dirty part of the preparation. But you have to clean the dirt also. There is no other way. So these are the typical memory bodies which are made up of intermediate filaments is what you need to remember histologically how the memory bodies look like. Gel balance, where do you find doctor? Gel balance, yes, gel balance, where do you find? One of the interesting question, yes. Gel balance are the feature of which important? Excellent, I am very sure you will all answer it correctly. Pheochromocytoma, absolutely. So these are basically called the gel balloon-like appearance where the polygonal spindle-shaped chromaffin cells and their supporting cells which are compartmentalized into small nests are called as the gel balloons is what need to be remembered. Pheochromocytomas can be benign or they can even be malignant. One of the favorite questions of the examiner is, what is the sign of malignancy in pheo? What is your answer, doctor? It is the presence of metastasis is considered to be the malignancy of the sign of the malignancy of the pheochromocytoma is what you have to basically remember. Now comes the next question. Post-streptococcal glomerulonephritis. What is that feature which you can call the characteristic pathological feature of PSGN is my question to all of you. 341. Excellent. Vishal says mesangial deposits. Come on Vishal, you can't do wrong like that. And Rajat also thinks crescents. Come on. And I can see majority of you are excessively seduced by the option C. But if you get seduced like that in the real exam, oh baby, you have to think twice before joining. So that's the reason, be very sure. Nandish Kumar and Pooja Koruprolu, they are absolutely right. Enlarged hypercellular glomeruli with the typical tufted appearance, most characteristic feature, uniformly increased cellularity of the glomeruli is what need to be remembered. Doctor, glomerulonephritis is a topic. Without that, there is no question paper. If you have done this question wrong, go back to the video library in the U Medico, master the topic of the glomerulonephritis which we have widely discussed, both theory and MCQs, and get ready for the sure shot topic like glomerulonephritis. Play quizzes on the glomerulonephritis and get at least 8 out of 10 score before you say, yes, I cracked this. Now, renal cell carcinoma, which has the best prognosis? Beautiful. I am finding chromophobe by Ashima. 100% sure about chromophobe. Excellent, Ashima. Chromophobe type. And it has got the best prognosis among all the renal cell carcinoma varieties is what you have to basically remember. They are the malignant renal epithelial tumors, the chromophobe. Ye batao yaar. Ring fibers are a feature of which important condition is a very good, very good. Maunika Lucky 343. What is your answer? Please mention the question number. Salvi is proposing myotonic dystrophy. Very good. Khanna Jaideep is saying limb girdle. Limb girdle also actually, yeah, that's good. And no, not Duchenne's muscular dystrophy. It is the myotonic dystrophy where you find this kind of a ring-like around the cell, the muscle cell, you have a ring-like appearance, and the markedly increased internal nuclei are present in multiple muscle fibers, is a very, very important feature. Myotonic dystrophy, and some literature says even limb girdle. I need to recheck that. Now, this is a very easy question, doctor. Most of you will crack it correct. Retinoblastoma agar hai to, what is its twin sister? Afsar, Ashraf, absolutely clean bold. Agar ye question, Deepti Birla, you have to build a lot of backup. This is the favorite, easiest, cheapest question on the planet. Ye bhi agar wrong kare to, you are in the amoeba phase, you have to come and grow big. Osteosarcoma. Very easy question. We should not do easy questions lost like that. So what are these rosettes called as? In the retinoblastoma, the typical winter rosettes. Yeah. Now doctor, if a substance, it is not a substrate participating in the reaction, but increases the reaction speed, what do you like to call it as? What kind of substance you like to call when it is not a substrate participating in the reaction, but increase the reaction speed? Give you one sure, short, confident answer. Yes. I can see Dhaval Salvi saying reversible inducer, positive inducer. Very good. Most of you. But Akanksha Agarwal, Jindabad, gratuitous inducer is what you have to remember. So, it is an analog of the natural inducer that is capable of inducing an operon, like a lac operon, is what you have to basically remember. And how does it induce? It will inactivate a repressor. So, that is called gratuitous inducer. Among all these drugs, what type of the drug do you think? I am very happy to see 343 online viewers, very confident about participating in the quiz, which is the most stimulating experience. I know that. Very good. So, I can see a lot of you saying lipophilic, some of you saying highly protein bound, and Vandan is saying highly protein bound. See doctor, what is volume of distribution? If a particular molecule doesn't stay in plasma, can go into all tissues very easily, then the volume of distribution will be very high. When that will be possible? All cells of the tissues have got a lipid bilayer. So, lipid soluble substances don't stay in plasma, but they will go into the tissues and volume of distribution will be very high. If they are highly protein bound, they remain in the plasma, they don't go into the tissues, then the volume of distribution will be lesser. That is what you need to remember. If you have done this question wrong, you go back to the pharmacokinetics video library in the UMedico app, revise it, last AIMS and DNB question bank, and play quizzes on the pharmacokinetic in the high yield topics. You will definitely get better. Now, first pass metabolism out of all this, which is an except about the substance that doesn't undergo high first pass metabolism, is my question to all of you. Yes. Ashima is saying nitroglycerin. Very good. I am seeing someone saying propranolol. Okay. Propranolol. Yes, doctor. Yes. Yeah. I am seeing people struggling between various options. Diazepam is the answer, doctor, but morphine, nitroglycerin, propranolol, they all have got a first pass metabolism very high is what need to be remembered. Now, doctor, there is a list once more. All these lists are a big torture in the exam hall unless you master them. Long QT leading to torticollis depointis, all these drugs cause, except which one? Ravi Kumar proposes acyclovir. Avinash also says the same. Sarita Yadav, clean bone. Lalit also says acyclovir. Yes. So you should know, doctor, prolonged QT is caused by which drugs? Terfenadine, astimizole, erythromycin, haloperidol, cisapride, pimozide, chloroquine, halophantrin, pentamidine, probucol, and tetracyclines like Kausalya, Supraja, Rama, Purva, Sandhya, Pravardade. Like that, morning when you wake up, you should have a list of things to revise until your exam, which you need to remember. After the exam, January 6th, no, 7th, bhul jao sabko, no problem, right? Now, beta blocker, one more list is waiting for you, doc. With intrinsic sympathomimetic activity, you should know the list. This is one question, you should not do it wrong. Which one among these beta blockers? Excellent, superbo. Most of you are saying Nadolol. Shoaib is saying Timolol. Oh. Ish Garg is saying Sotalol. Okay. So, doc, it is a Pindolol. Remember, cardio-selective, non-cardio-selective. With ISA, without ISA. This is a favorite topic. Acebutolol is cardio-selective with ISA. Cartiolol, penbutolol, pindolol are non-cardio-selective with ISA. Etanolol, metoprolol, bisoprolol, betaxolol without ISA, but they are all cardio-selective. And carvedilol, labetalol, nadolol, propranolol, sotalol, timolol, they are all without ISA, non-cardio-selective is what you need to remember. One simple way you can remember, doctor. कार्डियोलॉजी डिपार्टमेंट में यूज करने वाला सारे ड्रग्स जो होता है उसको इंट्रिंसिक सिंपैथेटिक एक्टिविटी नहीं रहता. Other than cardiology department, wherever you are using like cartiolol, penbutolol, pindolol, they all have intrinsic sympathomimetic activity is what you can be able to remember. Which is a uroselective alpha 1A blocker favorably used in the benign prostatic hyperplasia is the favorite question of the examiner. What is your confident answer, doctor? Yes. Uroselective alpha 1A blocker is the favorite question of the examiner. Superbo! Proud of you all. Tamsulosin, right? So this is how a typical tamsulosin looks like. It is a benzene sulfonamide. 1-2 comments iske bare mein. Used in BPH. It doesn't affect the blood pressure. And it is extensively metabolized by the SIP system, P450 system. So, since it is a sulfonamide, if there is any already sulfa allergy, you should ask before prescribing tamsulosin that with sulfa allergy it is contraindicated, or if somebody is taking P450 inhibitor, you should be careful to give it. One of the side effects of it, so it is highly selective alpha 1A in the prostate, retrograde ejaculation and intraoperative floppy syndrome. They are the two side effects of the tamsulosin which you should not basically forget. Which fluoroquinolone, very hot question, that crosses the blood-brain barrier maximally is the favorite question of the examiner. You should have this kind of list ready. Reading room जाते ना, डराने के लिए ऐसा questions रखना है जेब में. Yeah, I am seeing moxifloxacin and Shivam says parfloxacin. Then very good, and I am seeing lomifloxacin. Shibanu Jariwala, Jindabad. Pefloxacin is the one which has crosses the BBB maximally. Pefloxacin, very lipid soluble, and it passes into the CSF more than many other fluoroquinolones, hence used for the meningeal infections. And liver disease is an important thing you have to look for. Kidney Even if kidney failure is there also in meningitis, you can still give pefloxacin. And typhoid patients also, where you cannot give ciprofloxacin, you want an alternative drug, pefloxacin is good. And it is a long acting second generation fluoroquinolone and very potent fluoroquinolone, especially against tuberculosis as a second line drug. And it is also effective against Streptococcus pneumoniae is what need to be remembered. Then other fluoroquinolones, you should not do a mistake. Provafloxacin, notorious for the hepatic failure. Then two fluoroquinolones and photosensitivity. Please don't forget. Lomifloxacin, pefloxacin are the ones which have got a very high photosensitivity, one of the favorite MCQ of the examiner. Then coming to the gatifloxacin, one important side effect you should not forget. If somebody is taking oral hypoglycemic agents, typically it leads to development of hypoglycemia. It can even lead to hyperglycemia. That is about gatifloxacin. And in general, fluoroquinolones as a class of drugs, you should be doubly careful before administering to the children younger than 18 years because they destroy the cartilage and can lead to development of the arthropathy is what you need to remember. Now doctor, anti-pseudomonal cephalosporin. This is one question from times immemorial. This has been asked. We discussed in the recent class also. I don't know how much you are able to recollect. Arun says ceftri, and most of you are saying ceftazidime. That's right. I think Arun missed the other day class. Saket is also saying ceftri. Ceftazidime, doctor. Please don't forget. Piperacillin, ceftazidime, cefepime, imipenem, estrionam are the beta-lactam anti-pseudomonal. Tobramycin, gentamicin, amikacin among the aminoglycosides are anti-pseudomonal. Ciprofloxacin, levofloxacin among the fluoroquinolones are also anti-pseudomonal. This is the table that you have to set up a reminder. So shortly all these notes is going to come into the UMedico app. Just if you feel that wow, this is a good table and I love to be reminded by this, you can set up a notification and a reminder, and it keeps on popping up a notification to you on the app that do you like to know anti-pseudomonal penicillins, anti-pseudomonal drugs. You click on the notification, it will land you on the page and you will have a chance to review that. So that is how the UMedico will be your personal companion. Terbinafine hydrochloride is fundamentally what type of agent? I think cheapest question in the entire planet Earth. ये भी wrong करे तो doctor मैं free subscription दे देता हूँ आपको. I'm guaranteeing, right? अगर ये question भी wrong करे तो it is my social responsibility to give you Cosmos तुझे free दे देता हूँ मैं. Terbinafine antibacterial बोले तो कैसे है मेरे भाई? Huh? Very good, very good. Most of you are right. I know that. I know. Yeah. Terbinafine, even if azotemia or hepatic failure is there, it is still recommended. That's good. Which is that intravenous drug that is used for the hypertensive emergency management. It is available like a lipid emulsion and it is effective for both acute and pre-op and post-op hypertension. You have to be 100% sure about, doctor. Give me one strong answer. Yes. For this question. This is one question that decides how good you are. Excellent. I can see few of you saying metoprolol, and Manish is clean bowl, and most of you are absolutely right. Proud of you. Clevidipine, doctor, clevidipine. Clevidipine comes like a emulsion, right? And it is a calcium channel antagonist of dihydropyridine group, which is used for managing pre-op and post-op hypertension, is what you have to remember. इसका आंसर बोलो यार. This is one question. I'm telling you, doctor. If you have done this wrong, you need to go back today only in the video library and review on the UMedico app all the antiarrhythmics, past questions of DNB, AIMS and theory about it, right? Very, very important question. I am getting quinidine as an answer, flecainide, Pooja is proposing flecainide, Shivam is proposing quinidine, and Priya likes to try her luck with lidocaine. Priya Jindabad, Dr. Priya Jindabad, lidocaine. You should not do this question wrong. If you have done this, today night only go back to the video library, pharmacology में antiarrhythmics बोल के I reviewed it for about 20 minutes. Dr. Shailendra also review video is there, and the AIMS PGI question bank, all antiarrhythmics questions are there. Video library in the UMedico app. To review them, take a quiz, and be sure you get 8 out of 10 in the antiarrhythmics in the quiz on lidocaine, on the antiarrhythmics. So, doctor, please don't forget. There is one important picture you have to bookmark today only for a revision down the line. Class 1, they decrease the slope of the phase 0 depolarization. In that, the class 1A, they increase both effective refractory period and also the action potential duration. Both are increased by class 1A. Class 1B, they decrease both the ERP and also action potential duration. Class 1C, they keep the effective refractory period normal and AP, action potential duration also normal, is the nature of the class 1C. Then class 2, they decrease the slope of the phase 4 because they act on the potassium channel, right? So they basically they decrease the slope of the phase 4 of depolarization, and they also prolong the repolarization of the AV node, and they increase the PR interval, class 2. Then class 3, they increase the effective refractory period and increase the AP duration, and they prolong the repolarization is what need to be remembered. Once more, if you look at the class 4, they increase the PR interval and they increase the effective refractory period and they prolong the repolarization in the AV node. This is one table about the various classes. You should be 100% sure. Invariably, the questions are asked. Okay, doc? Now, endothelin receptor antagonist. Which drug is basically called endothelin receptor antagonist, doctor? One loud answer, please. Yes. Bosentan. Absolutely right. Don't forget about bosentan. What type of drug is this? Bosentan? Non-selective endothelin receptor antagonist. Pulmonary arterial hypertension it is used to treat, and it is a indication, it is indicated whenever the patient is having a NIHA class 3 or class 4 type of a congestive heart failure, right ventricular failure. Typically pulmonary hypertension people will have a right ventricular failure. So class 3, class 4 it is indicated. Now doctor, this is a easy question. If you do this wrong, no, high time you go back, check the video library and then revise all HIV drugs. Today only you should do that if you do this question wrong and play quizzes on the HIV. My job is to remind you. Pooja, absolutely great and sweet. Indinave, absolutely right. Very good, proud of you. Cholestatic jaundice. All these drugs can lead to cholestatic jaundice. Which one is not implicated? 358. Please punch the question number and give me the answer. 358. Cholestatic jaundice. Yes, doctor. I am seeing between oxipils, erythromycin. Oh, erythromycin you should not do wrong, but don't do blunder. I'll be crying, right? So, I'm getting acyclovir. Ankita Swami, Jindabad. So it is acyclovir. Otherwise, chloropromazine, ocipils, erythromycin. Please don't forget, doctor, drug-induced cholestasis causes. Favorite MCQ in NEETPG. Cholestasis without hepatitis. Estrogen, anabolic steroid, cyclosporin, tamoxifen, azathioprine. Cholestasis with hepatitis. Cholestasis with the bile duct injury. Especially flucloxacillin. I still remember one of my very good friend. He is a doctor, top doctor. His father, he had a renal failure and amoxicillin clavulanate he took. Finally, he went into hepatic encephalopathy, and after he passed away, we have taken the liver sample and quickly checked the histology. Completely smashed, doctor, the liver. All cells are gone into necrosis. So amoxicillin clavulanate and leading to cholestasis with hepatitis. I can never forget from my own friend's father's post-mortem biopsy. Right, doctor? So be very cautious, careful. Even a grandmother talks about the clavum augmentin whenever she is having a little bit of fever. It is almost used like a OTC by many people. But we need to be doubly careful about the possibility of a cholestasis with hepatitis with the clavulanate. Now, doctor, fat soluble vitamins, impaired absorption is the important side effect of which laxative? This is another disgusting topic. Laxatives is one thing that we often ignore, but in pharmacology it is a good, it's one topic that if you read, there is a chance that others don't read and you will get the score, that kind of a topic. Very good. I am seeing liquid paraffin, few saying magnesium hydroxide, Nandesh Kumar Jindabad, dioctyl sodium sulfosuccinate. The long-term use of this stool softener, it can impair the absorption of fat-soluble vitamins. What is that movie of Amitabh Bachchan? Pico with constipation. I could not recall the name. Pico or what is that movie name? Amitabh Bachchan ka? About constipation. That was a big story. Can do anybody remember? Can punch it? We should keep watching some nice movies which talk about the PG entrance topics. Pico, yeah, that's right. Pethidine differs from morphine in which important effect? Only pethidine produces, but morphine doesn't produce that particular effect. How pethidine differs from morphine? Oh my God. Pico also has got a lot of good answers. Good. At least this evening you will remember, and tomorrow the same question comes in NEETPG. Don't tell me that who made the paper out. Huh? So yes. Shoaib Bhagat is saying euphoria, tachycardia. Excellent. Pethidine produces tachycardia, dry mouth, and less marked amount of meiosis compared to that of the morphine is something that you need to remember. This is the cheapest question, doctor. All of you will answer. N-acetylcysteine. It is used for the treatment of toxicity of which important entity, doctor? Even indications you should know. Yes. Very good. Next question. Excellent. All of you will answer this correctly. I know that. Acetaminophen. Among these, one of the agent is a good anticonvulsant, but we don't use it for that purpose regularly for it to be taken because people develop tolerance and the side effect of sedation is limiting factor. Which one out of all these agents qualifies this excellent? Kushbu, absolutely right. Diazepam. Which is a drug among these which is used for Parkinsonism? I think cheapest question on the planet. Shoot your answer. 362. Excellent. Trihexyphenidyl. So what are the important groups of, once more doctor, Parkinsonism drugs? One question invariably comes. Today only go back to the video library on the UMedico app and play the quizzes in pharmacology on Parkinsonism drugs. Levodopa. Similarly, you have dopamine receptor agonists. Bromocriptine, pergolide, pramipexole, ropinirole, they are all dopamine receptor agonists used for treating Parkinsonism. MAO inhibitors, salicyline and rosagiline. And catechol O methyl transferase inhibitors, COMT inhibitors, tolcapone and entacapone. Then you have amantadine. Then there are certain anticholinergics, especially between rigidity, echinacea, tremor. Which is the one that responds to the anticholinergic drugs, doctor? Tremor. If you want to control tremor of all the various drugs, it is the anticholinergic drug class is specially meant for handling the tremor of the Parkinsonism triad is what you have to remember. Benzotropine, orphanedrine, procyclidine, trihexyphenidyl, these are all called the anticholinergic Parkinsonism, specially effective for tremor is what you have to basically remember. Which is that SSRI? Oh, once more, a psychiatry drugs doctor, I feel like killing the chapter, tearing it off. Our exposure to psychiatry is very little in medical college, but entrance exam may, examiner will rip you off like you are the top Sigmund Freud ka grandchildren. So tell me, it does not have its own metabolite. That's the reason it has the shortest half-life. Let me check who will correctly answer. Cosmos is 100% sure on escitalopram. I am seeing someone saying fluoxetine. Okay. Someone, let me check who is correct. Most of you are seduced by the option escitalopram. Yes, you all want to bet on that only. Saurav Singh Jindabad. It is a fluoxamine. So, fluoxamine is the one which is considered to have shortest half-life. Regarding SSRIs, what are the adverse effects, doctor? Famous mnemonic, 3 S you should remember. They cause the stomach upset, they cause the sexual dysfunction, they cause the serotonin syndrome. They are the 3 important things. Somebody young married comes to you because of whatever the reason, NEETPG में seat नहीं मिला, नहीं तो मिले तो मुझे pediatrics चाहिए, general medicine मिला इसलिए मैं depressed हूँ. If he happens to come, don't give SSRI. SSRI, sexual dysfunction, very closely related. Then, what are the drugs which are called SSRIs? Effective for sadness, panic and compulsions. That is a board you should remember. Effective E is escitalopram for fluoxetine, fluoxamine. Sadness, which is sertraline, and panic is paroxetine, and compulsions means citalopram is what you need to basically remember. Who did the original discovery of Gill-Nielsen stain is a very important question. 365. Yes. Who has discovered 350 toppers in NEETPG? Dr. Murali Bharadwaj has discovered. That's where all our toppers are sitting over there across the country, including Nepal and China. Good. I'm proud of you for this evening. I'm finding Kinyun, Paul Ehrlich in his graveyard will be very happy that so many students have remembered him for the original discovery of the Gill-Nielsen's stain is what need to be remembered. How many of you have Netflix? I don't know. If you have Netflix, there's a very interesting serial called American Genius. So it talks beautiful story. Dinner time or sometime when you are bored with studies, please review, see that serial. It will be inspiring you once more to study. So the next 2-3 months, doctor, surround yourself with the positive things. I'm going to win. You are going to win kind of things. That is very, very important. Kaufman-White classification scale. Where do you see that? Salmonella. Absolutely right. So, Kaufman-White is based on the O and H antigens. Salmonella typhi is VI capsular antigen, and this is how Kaufman-White and Salmonella should be remembered. This is another dirty question which you have to be sure when you are going to exam. What is the temperature and the holding time in the autoclave? If you don't answer this question, you should be prepared to join MD microbiology. Ravi Kumar says D, but most of you, very good, very good. Somebody 10 B's, absolutely. 121 degrees Celsius for a whole time of 15 minutes. These are some very standard questions. First synthesized immunoglobulin in the fetus, which one it is? A relatively easy question, yes. First time synthesized in by the fetus. Should your answer, doctor? Yes, I am seeing IgM. Even this question, if you do wrong, doctor, I will give you free subscription. Ashok and everybody, yeah. IgM, doctor, not G, which will cross the placenta from mother to the child. Ganga bahti hai. So IgG crosses placenta. IgM doesn't. IgM, if at all is produced in the fetus only. That is what you need to remember. Selenite F broth. What is this called as? What type of medium is the selenite F broth? Should your answer? Yes. I am seeing Lalit saying enrichment and Shivam saying selective medium. Easy, cheapest question on the planet. This you should not do wrong. Absolutely. Enrichment medium. What do you mean by enrichment medium? It will either stimulate or inhibit the growth of a particular set of organisms, is called enrichment. Selenite F broth is an enrichment for the isolation of Salmonella because it won't let others to grow. Tetrathionate broth is another example where tetrathionate inhibits the coliforms but allows the growth of the typhoid, paratyphoid bacilli to grow. That is the speciality of tetrathionate broth, is what you need to remember. How do you differentiate a community acquired and a hospital acquired strain of MRSA? The one which produces a particular type of toxin, detection of that is the way you will detect. Give me a confident answer. Yes. 371. Hugh-Levinson test. Oh my God. What is that? I don't know what it is, Shashank. Generally the rule is a unknown unknown is worse than at least a known unknown, right? So be very sure. Excellent. Panton, Valentine, leukocidin test. Tell me this, doctor. If you answer this wrong, no. My first class of microbiology is about this only. Last Monday. मैं तो अभी चागपत्र देके काशी को चले जाता हूँ. You should answer this correctly after all our discussion in the last section. Yes. 372. Come on, doctor. Start your answering. Bipesh says Besitracin. Shashank says alpha hemolytic. Besitracin. B for sure, sir. Absolutely, sir. I am also proud of you, sir. Streptococcus pyogenes is sensitive to Besitracin than any other streptococci. That's how Besitracin is used for beta hemolytic streptococci. Is what you need to discuss किया ना doctor. Which Shigella doesn't ferment the mannitol? Interesting question. Favorite standard question. 373. What's your answer? 373. I am seeing voidii, soniae, dysenteriae. कोई सी भी बोलो. विपेश सी भी बोला. Dysenteriae, doctor. Dysenteriae. Favorite question. Now, what is the most important vector for the leptospirosis is my question to all of you. Yes, doctor. Yes. I am seeing leptospirosis 374. Mark the question number. Yes. Retus ratus. Don't tell me Norvegicus. Retus ratus is the one which is that rat found in India. So, अगर ये क्वेश्चन रॉन्ग आंसर किए तो रेटस रैटस का पोस्ट नीट पीजी your main job will be to catch rats only in the reading room. Aseptate hyphae with asexual spores. This immediately takes you to which answer? Shoot me one confident answer. I want to see 500 plus students. Please send your classmates so that we'll have more and merry. Yes. I can see zygomycetes from a good number of you, like gracilin vinyl. Absolutely right. Zygomycetes. Zygomycetes, they have asexual spores, sporangiospores, rhizopus, absidia, mucor. They are all examples of zygomycetes. This is the cheapest question. You should not do this wrong. After all our dermatology class yesterday, trichophyton, what does it affect? Trichophyton. Yes, doctor. Skin and nails only. No. Yesterday only we discussed, doctor. You should not do wrong. Skin. Tri hota hai triveni sangamam. Skin, hair and also nails. Bolo, doctor. Which is not a DNA virus. There is a very, yesterday only we discussed about the viruses, right, recently. Yes. Which is not a DNA virus, that means it is a RNA virus. In the name itself, it is there that it is a RNA virus. Who will tell me the correct answer? Bolo. 377. Shoot 377. In the name itself, it is there. Picorna, Aparna, RNA. You should basically remember. Picorna, Aparna, RNA. Yes. Picorna virus. Which is a viviparous parasite is my question to all of you. Very easy question. Viviparous. Both male, female, that is Ardhanarishwar parasite. Which one it is? 378. Nicator americanus. Come on, where did it come from? Right in our CBSE 10th class days only, Ashima, we read about Eukaryaria. No, Ashima is wrong. Eukaryaria, Bankrofti. Easy question. River blindness is caused by. If you answer even this question wrong, free enrollment and subscription to UMedico. 378. 9. 379. Yes. Excellent. All of you are saying A. Onchocerca volvulus. So that brings us to the end of the today's journey, doctor. Last 10 days, we are having a non-missing, non-arrhythmic session without any missing beats. I hope that this last 10 days must have brought a different kind of shape, energy among all of you. If it has really brought, I am the happiest person on this part of the world, right? And tomorrow once more with more energy, I wish you all start playing more and more quizzes. I want to see 10,000 quizzes played every day. And WhatsApp to our helpline, and they will help you to get a quick subscription to the entire video library, Sunday mock tests and discussions, everything. and even these sessions are also uploaded into the U-Medico shortly. Yeah. So thank you all for a wonderful time. We will catch up tomorrow. Thank you.